The pain in your tooth had been getting worse for 3 days. It started as a dull ache and had become a throbbing agony that made it impossible to eat, sleep, or think about anything else. You were 14 years old, lying on a straw mattress in a room you shared with 6 other family members, holding your swollen jaw and crying. Your mother had tried everything she knew: hot compresses, cold compresses, herbs she'd gotten from the woman down the street who knew about healing plants. Nothing worked. The pain just got worse. Now your face was swelling. The infection was spreading. You could feel the heat radiating from your jaw. Your father finally decided you needed to see someone, not a doctor. Doctors cost money your family didn't have. But there was a barber surgeon in town who pulled teeth. Your father took you there on the 4th day when your fever was climbing and you could barely walk. The barber surgeon looked at your tooth, nodded, and told your father it needed to come out. He sat you in a chair. No explanation, no warning. He grabbed your head with one hand, forced your mouth open, and jammed a pair of iron pliers onto your infected tooth. Then he pulled. You screamed. The pain was beyond anything you'd ever imagined. He pulled harder. You could hear the tooth cracking, feel pieces breaking off. He kept pulling, twisting, tearing. Finally, the tooth came out, along with pieces of your jawbone. Blood poured from your mouth. The barber surgeon stuffed a dirty rag into the hole and told your father that would be 2 pence. You stumbled home, bleeding, the pain somehow worse than before. The infection didn't stop. It spread into your jaw, your neck, your blood. Within 2 weeks you were dead, from a toothache. Because this was life before modern medicine, where something as simple as an infected tooth could kill you. And there was nothing anyone could do to stop it. The centuries before modern medicine, roughly before the late 1800s, saw humanity essentially helpless against disease and injury. There was no understanding of bacteria or viruses, no concept of infection, no antibiotics, no anesthesia, no sterilization. Medical knowledge was based on centuries-old theories that were completely wrong. Physicians believed illness came from an imbalance of 4 humors: blood, phlegm, yellow bile, and black bile. Treatment involved trying to rebalance these humors through bloodletting, purging, and induced vomiting. These treatments didn't work. Often they made patients worse, weakening already sick bodies. Surgery was brutal and usually fatal, performed without anesthesia except maybe alcohol or opium if you were lucky. Conducted with unsterilized instruments by practitioners who didn't understand infection. Most surgical patients died, either from shock during the procedure or from infection afterward. Simple injuries could be death sentences. A broken bone that didn't set properly could cripple you for life. A cut that got infected could kill you. Childbirth killed women constantly. Diseases that are easily treatable today, pneumonia, appendicitis, infections, were often fatal. Life expectancy was low not just because of poor nutrition and living conditions, but because medicine couldn't save you from anything. Your body either healed itself or you died. Those were the only options. Catherine Wells was 16 when she developed appendicitis in 1762. She lived in a village in rural England with her family. It started with stomach pain. Sharp, localized pain in her lower right abdomen. Within hours, the pain was excruciating. She was vomiting, running a fever. Her parents called for the local physician, one of the few educated doctors in the area. He examined her, pressing on her stomach, asking about her symptoms. He had no idea what was wrong. The appendix wouldn't be understood for another century. He diagnosed it as a blockage of the bowels and prescribed a purgative, a strong laxative designed to empty her system. Catherine drank the mixture and spent the next hours in agony as her body tried to expel nothing. The purgative made everything worse. The violent contractions put more pressure on her inflamed appendix. On the 2nd day, it ruptured. Catherine screamed as the infected contents of her appendix spilled into her abdominal cavity. Peritonitis set in, a massive infection spreading through her abdomen. The physician returned, saw that she was worse, and prescribed bloodletting. He cut open a vein in her arm and drained a pint of blood into a basin. The theory was that removing excess blood would reduce the fever. It didn't, it just made Catherine weaker, unable to fight the infection consuming her from the inside. Catherine spent 5 days dying. The infection spread through her entire abdomen. Her stomach swelled until she looked pregnant. The pressure was unbearable. The pain was constant, so severe she couldn't even scream anymore. She just moaned, a low, continuous sound that her family couldn't bear to hear. They sat with her, held her hand, prayed. There was nothing else they could do. Modern surgery could have saved her. A simple appendectomy, removal of the infected appendix before it ruptured. A routine procedure today. But in 1762, it was impossible. No one understood what was wrong. No one knew how to fix it. Even if they had known, surgery without anesthesia or antiseptics would likely have killed her anyway. Catherine died on the 5th day. The infection had poisoned her entire system. Her last hours were spent in delirium, her body shutting down organ by organ. She was 16 years old. She died from appendicitis, something that today is treated with routine surgery and antibiotics. Survival rate is over 99%. In Catherine's time, it was 0. If your appendix ruptured, you died. Period. There was no treatment, no hope, just suffering until your body gave out. Pain was a constant companion for sick people. With no effective pain relief, you simply endured. Broken bones were set without anesthesia. You'd be held down by multiple people while someone manipulated the broken ends back into place. People would scream themselves hoarse from the pain, sometimes passing out from shock. Surgery was the same. Amputations, the removal of bladder stones, any procedure was done with the patient fully conscious and feeling everything. Surgeons prided themselves on speed. The faster they worked, the less time the patient spent in agony. But fast didn't mean painless. It meant brutal, traumatic procedures where patients often died from shock during the operation. If you survived the surgery, infection usually killed you within days. Surgical instruments weren't sterilized. Surgeons didn't wash their hands. They'd go from patient to patient, from corpse to living person, spreading infection wherever they went. They didn't understand why patients developed fevers after surgery. Didn't understand that they were killing their patients with their own unwashed hands and dirty tools. The mortality rate for surgery was over 50% for most procedures, higher for complex operations. You went into surgery knowing you'd probably die. It was a last resort when death was already certain without intervention. If you were Catherine, lying in bed with your appendix rupturing, feeling the infection spreading through your body, knowing there was no treatment and no hope, just waiting to die in agony over the course of days, how would you have faced that? What would you have thought about? Would you have been angry at the injustice, or would you have just accepted it as the way things were? Childbirth was one of the most dangerous experiences a woman could face. 1 in 10 women died in childbirth or from complications shortly after. The causes were numerous: hemorrhaging, infection, obstructed labor where the baby couldn't pass through the birth canal, eclampsia, postpartum fever. With no understanding of sterile technique, no ability to perform safe cesarean sections, no blood transfusions, no antibiotics, complications that are manageable today were death sentences. Midwives did their best, but they were working with limited knowledge and no tools. If labor went wrong, there was often nothing that could be done except watch the mother die, sometimes the baby too. Women knew pregnancy might kill them. They wrote goodbye letters to their children before going into labor, made arrangements for who would care for their existing children if they didn't survive, went into childbirth knowing it might be the last thing they ever did, and many women had multiple pregnancies. 5, 8, 10 children. Each pregnancy was another roll of the dice with death. The cumulative risk meant that most women knew someone who died in childbirth: a sister, a friend, a neighbor. It was common, expected, a fact of life that women simply had to accept. But here's what makes life without modern medicine even more horrific. The suffering was preventable, not with the knowledge of the time, but the knowledge existed elsewhere or would be discovered soon. Germ theory was developed in the mid-1800s. The idea that microscopic organisms caused disease. Once that was understood, everything changed. Sterilization, hand washing, antiseptics. Suddenly surgery became survivable, infections became preventable, but for the centuries before that discovery, millions of people died from causes that would soon be preventable. They missed modern medicine by decades or sometimes just years. Catherine died in 1762. Appendectomy was first successfully performed in 1848, 86 years later. If she'd been born less than a century later, she would have lived. That's the cruelty of it. The knowledge was coming. The solutions were being developed. But they came too late for her and millions like her. They died in the darkness right before the dawn. And even after medical knowledge advanced, it took decades for it to spread beyond major cities and wealthy patients. Poor people continued dying from preventable causes well into the 20th century because they couldn't afford doctors or hospitals or treatments that could have saved them. Think about the last time you were sick. You took medicine and felt better. You went to a doctor and got treatment. You recovered. Now imagine none of that existed. Imagine getting sick and just hoping your body could fight it off because there was no help available. That every illness might be fatal. That pain was something you just endured until you either healed or died. Could you have lived like that? Knowing that any day could bring an illness or injury that would kill you slowly while you stayed fully conscious and aware. Most people in the past lived with chronic pain and illness. Dental problems were universal. Without modern dentistry, teeth rotted and caused constant pain. People lost teeth young and spent the rest of their lives unable to chew properly. Infections were common. Vision problems went uncorrected. People went blind from cataracts that could be easily treated today. They lived with hernias that could have been repaired with simple surgery. They suffered joint pain from arthritis with no pain relief. They had kidney stones, gallstones, chronic infections, all with no treatment. You just lived with it, adapted, suffered. There was no choice. Catherine's death from appendicitis was just one example. Her neighbor's son died from pneumonia, a respiratory infection that antibiotics would have cured in days. He suffocated slowly over 2 weeks as his lungs filled with fluid. Another neighbor lost 3 children to measles in 1 year, a disease that's now preventable with a simple vaccine. The village lost its blacksmith to an infected cut on his hand. The infection spread up his arm, turned gangrenous, and killed him before anyone could amputate. Death was everywhere, constant, unavoidable. People lived with the knowledge that they or their loved ones could die at any moment from causes they couldn't control or understand. Catherine's family buried her in the churchyard. They grieved. They moved on because they had to. Life didn't stop for death. There were crops to tend, work to do, surviving children to feed. Catherine's mother had 7 other children. She couldn't spend months grieving. She cried, then got back to work. Catherine's father felt guilty, wondered if he should have called the physician sooner, tried different treatments, done something more, but there was nothing more. No treatment would have saved her. She was doomed the moment her appendix became infected. Her death was inevitable. He eventually accepted that, had to, otherwise the guilt would have destroyed him. Catherine's siblings barely remembered her after a few years. She became a story. The sister who died young, another name added to the family's list of dead children. Most families had similar lists. Children who died in infancy, siblings who died from disease or injury, parents who died young. Death was woven into the fabric of life so thoroughly that people became somewhat numb to it. Not uncaring, just adapted. Able to function despite the constant presence of death because functioning was the only option. The centuries without modern medicine killed hundreds of millions of people, people who would have lived if they'd been born later. If they'd had access to antibiotics, vaccines, surgery, pain relief. Their deaths accomplished nothing, taught nothing that couldn't have been learned another way. They just suffered and died because they had the misfortune to be born before medical science advanced. Catherine died at 16 from an infected appendix. Today, she would have had surgery, recovered in a few days, and lived a full life. But she was born in the wrong century. So she died in agony over 5 days while her family watched helplessly. That's the reality of life before modern medicine. Not noble suffering, not heroic endurance, just preventable deaths that weren't prevented because the knowledge didn't exist yet, just people dying from causes we now consider routine and treatable. Just the brutal fact that for most of human history, getting sick meant accepting that you might die and there was nothing anyone could do to save you. Even after modern medicine developed, access was limited. Wealthy people benefited first. Poor people continued dying from preventable causes because they couldn't afford treatment. The gap between what was medically possible and what was actually available to most people remained vast well into the 20th century. Antibiotics were discovered in the 1920s, but weren't widely available until the 1940s. People died from bacterial infections in the 1930s while the cure existed in laboratories. They just couldn't access it. That pattern repeated with every medical advancement. New treatments were developed, but they reached only those who could afford them. The poor continued suffering with the old reality of medical helplessness, while the rich enjoyed the benefits of progress. Catherine died in 1762, but people were dying from appendicitis in 1920 because they lived in rural areas with no access to surgery. The timeline of medical progress matters less than the timeline of access, and access was determined by wealth, geography, and social status. Medicine advanced, but for many people, that advancement might as well not have happened because it never reached them. The lesson from Catherine's death and millions like it is that modern medicine is a miracle we take for granted. That living in an era where most diseases are treatable, where pain can be managed, where surgery is safe, where childbirth rarely kills, is an extraordinary privilege. For most of human history, none of that was true. People suffered in ways we can barely imagine, died from causes that seem trivial today, lived with constant pain because nothing existed to relieve it, and they had no choice except to endure. Catherine endured for 5 days. Then she died. That was her entire medical experience. Pain, ineffective treatment, more pain, death. No hope, no rescue, no miracle cure. Just the grinding reality of a body failing while medicine stood by helplessly. We've escaped that reality, but only recently, only in the last century or so, and only in parts of the world with access to modern healthcare. The rest still live with echoes of Catherine's experience, still die from preventable causes, still suffer without adequate pain relief, still face childbirth as a life-threatening event. Modern medicine hasn't reached everyone, and even where it has reached, it's fragile, dependent on systems that can fail, on access that can be denied, on a society that decides everyone deserves care. Catherine's death reminds us that what we have is precious, recent, not guaranteed to last if we don't protect it. She died because she was born too early. Others die today because they were born in the wrong place or to the wrong circumstances. The causes are different, but the result is the same: preventable suffering, preventable death, and the knowledge that we could do better if we chose to. That's Catherine's legacy. That's what her death teaches. That medicine is only as good as people's access to it. And that access, not knowledge, has always been the real problem.